Good morning, everyone. I'm Dr. Gina Mistry, and I'm an MD pharmacologist. I'm working as a senior resident at GMERS Medical College, Navsari. Today, I'm taking a webinar on a pharmacology career counseling. So I want to say that if someone wants to take a MD pharmacology, it's maybe a professional suicide thing before you take, because most of the time I say that I've seen that the MD pharmacology students or undergraduate students taken the pharmacology by a chance, but not by a choice. Because not lots of the junior who are much more talented than anyone who are struggling for none of their mistakes just because they did MD pharmacology. I selected this sentence from the core because uh, students don't know about the importance of pharmacology branch as well as the various opportunities after the MD pharmacology. So aimed for that particular webinar on pharmacology career counseling is only that uh, I want to guide you in particular direction, as well as I want to give some guidance regarding the opportunity after the MD pharmacology. Most of the time, the students set their boundaries in particular area. Don't think beyond your boundaries and don't want to just explore the subjects in very well or in a depth. So I just give you just hint or some suggestion that you just think before your beyond your boundaries. Think regarding that the subject is not a small and subject is not a limited particular area. It's really have a good opportunities. It's really a good thing, learning process and everything. If you want to think beyond your boundaries, so just don't set your limit, but always to achieve beyond it and do the some impossible thing which anyone can do. So in the academics, what you can do that in the first year, second year, and third year residency, because it is your golden time. Most of the time, the people waste in 3 year of residency because they don't know what to do. So I just give you some basic info and brief idea that whatever you can do, which are based on my experience, and I was to trying to do that at that time. In the first year, I just doing some reading of the standard book, whichever I read in the my undergraduate thing. And then you can do the second thing is the protocol writing, which is really helpful after MD and in the manuscript making, publications. So this is really important in first year. And in protocol writing, you just also try to connect and correlate your clinical fellow and explore the topic, right? Because after MD, it's really helpful if you are going in the industry as well in economics. So particular area of interest you are just built, that is, if you are want to go in oncology, if you are going to the dermat, then diabetes, cardiovascular. So this is also some branches after you go in the MD. So think your title according to your area of interest in the protocol writing and do the research in particular area which are really interested from you. So this is the two things you can do in the first year residency if you feel possible to do. And this in the second year residency, you understand the topic and the area and the particular concept regarding the pharmacology. And second thing, you continue your protocol writing and then starting the data collection as well as writing a review of literature, discussion part, as well as the result parts in your manuscript. So it's really helpful for your publication, and as early you can complete your thesis. So it's really helpful for your third year residency to read more about the subject. So understand the topic and go in the depth in pharmacology in the second year. So this is such a good time. In the third year, definitely you have stressed out to complete your thesis, giving the exams like prelims and university. So at least you try to complete your work in the second year end. So in the third year, you can do the more ideas and more knowledge about the pharmacology and just try to select a branch which are suitable for you after the MD. So you can, if you select your branch, then you can do the viva and interviews before you're completing your exams too, because most of the time they are hiring you before just completing your exam, your MD exams. So this is a good opportunity if you are a learn about the subjects as well as to select your branches, what you can do after the MD pharmacology. So if you are going to be an academic person, then you should to do a senior residency. And it is a golden period if you are don't decide and don't know what you do after the MD pharmacology. So senior residency is a good thing to explore these branches which are suitable for you, as well as the read the subjects in depth. And I'm trying to read Goodman and Gilman, which is a Bible of pharmacology, and really helpful for me to understand the pharmacology in depth. Even third year, 3 year of residency, which is not enough to understand a particular topic or a subject. So this is the good time to do a senior residency if you can. And some of the state having the bond criteria also to do a senior residency for particular branch. So it's must for that. And if you have a choice, then it's up to you. Then what are you do after MD pharmacology and post MD pharmacology? So I will give you the some basic brief information regarding the various branches, which really helpful for you after to select the branch in after MD pharmacology. Just example that course, that is a medical advisor. I'm giving the idea depending on the branch, not but the opportunity and growth or promotion based, but I'm giving the basic information regarding it. So first, that is a medical advisor, which is having the position like medical advisor, regional medical advisor, then medical science liaison. This is the medical marketing branch. Name itself suggests medical advisors. You advise a medically in the different stakeholders, then marketing teams, and doing the marketing, that medical marketing, the medical team and marketing team, which are searching a new drug molecules and explore and marketing particular in the way, in the SOP wise, in the protocol wise. And this is the also a growth wise good branch for you, as well as the traveling is, if you like to travel more, then it is such a good branch for you, because in the medical advisor you most of the time traveling, because you connect and communicate with the co-fellows, then which different clinicians as well as stakeholders, you are train them. So this is the good branch for if you want to do. Second, that is the clinical research organization. In the clinical research itself suggests you are researching something regarding the drug molecule from bench sites to bed sites, and also doing the existing drug molecule with the newer indications, and the BA studies, clinical studies like phase 1, phase 2, phase 3, and phase 4 studies, and post-marketing surveillance of that particular drug molecule, which are you are doing a very various responsibility work to do that particular clinical studies. Maybe you need to work 24 by 7, you are available 24 by 7, and it is growth wise also a good branch. And also traveling is less as compared to the particular setup like hospital based setup work, and you need to work in 24 by 7 if needed. So, as according to, if you are going to be a research person, that is the good branch. Third, that is a pharmacovigilance branch. The pharmacovigilance you also aware during the residency, because the National Pharmacovigilance Week also celebrated every yearly and by the IPC. In the pharmacovigilance, you can do a signal detection, EDR reporting, coordination with the IPC and the CDSCO, then the various regulatories. Then it is a good branch if you are doing office-based or a desk-based work if you want. The traveling is less and growth opportunities also good in as like the medical advisor and CR. Then fourth, that is the medical writing branch. That is, I already mentioned that you are doing a first year, second year in the thesis making. That is the protocol writing, then literature review, manuscript, and publication. So if you are doing the very ethically, scientifically in your residency, so this is a good thing. After that, you completing your MD Pharmac, you are almost aware and skilled and enriched your knowledge regarding the medical writing. Fifth, that is the DM pharmacology. So DM pharmacology having its own SOP and curriculum, so you can read in if you want. And the most of the time the questions arise that the MD versus the DM. So I just give you the advice that DM it should be two, but it's not must be two. If you are enriching your knowledge, then it should be two. But as a job wise, as a promotion wise, it's not major any concern regarding that MD versus DM. But yes, you can enrich your knowledge because clinical studies and toxicological studies and various things which are visible to in your MD curriculum that maybe you have the opportunity to explore that particular thing in DM form. And the other branch that is the other opportunities that is abroad. If you are doing some medical advisor, CRO, and PV, your company according to your skill and promotion, they offer you abroad scope and opportunity to do a work in say 2 years and 4 years maybe. And also you can do if you are permanently want to go abroad as based on the pharmacologist, you can do a PhD and USMLE. This is the opportunity in abroad. So I will also do a webinar on the abroad aspect and the country aspect wise the pharmacology opportunity as well as the position and the various job opportunity regarding that. And thank you. So this is the various branches. Other than that is the regulatories also like a DCGI, CDSCO, pharmacovigilance like IPC Ghaziabad. So you can work also in the regulatories if you want to do. Other than this, I explore most of the time the questions asked to me that is the most of the time the pharmacologists also want to work in a hospital. So I just share my experience as a clinical pharmacologist, which I have worked at the Srimad Rajchandra Hospital and the research center at the Dharampur, Valsad, in the state of Gujarat. Here I was done there. I was done the research activities, then antimicrobial stewardship program, then surveillance of various antibiotic prescription audit, then how they are prescribed the antibiotics and the various resistance regarding it, then research activities like observational studies if I can, clinical trial which under development, so maybe are not a good opportunity as a single page because it needs the setup and various things. So research is maybe a observational based. Then third, that is the pharmacovigilance activity. I also reported 10 to 15 ADRs within a month because I was done the pharmacovigilance. I celebrated the pharmacovigilance awareness week from the IPC Ghaziabad and in various stakeholders like RMOs, then consultants, nursing staff, then patients also. I also aware the patient regarding the which kind of a drug you can take, as well as the which are the various side effects and how to report it. So they are most of the time they are don't know which tablets they are taken. So this is a good thing which I feel to do at the rural based area. And the another thing that is the other than this, you can do a prescription writing as well as a clinical audit, mortality audit. I also done in during the clinical pharmacologist because you can understand that thing very depth, very pharmacology wise. Because most of the time, the disease etiology as well as the laboratory etiology and the for drug related etiology, which affect the patient's life, so you should know that which are the various drug-drug interactions, which are the timing, particular dose of the drug, duration, then medication error. So this all thing you can need to surveillance on the basis as a clinical pharmacologist. And this is the upcoming branches, maybe not all in the India, all India level that is the implicated, but metro city and some hospitals now allotted and recruited the clinical pharmacologist branch. So this is really important and hope this is emerging and hope this is implemented as soon as possible because we are also want to work in the hospital too. The other thing that is asked majority of time that which are suitable as academic. versus industry, which are the best. But I say that every branch has their own pros and cons. If you are doing the academic, that also have a good opportunity rather than to be not doing anything in the academic. Because as an academician, I do a lots of the thing which I don't think as well as don't implicated. I'm giving some example like that. I'm teaching my undergraduate students as a clinical pharmacologist, not only just to be a pharmacologist. As academician, you are need to be updated. You are implicated NMC implications, SOPs, then CBME curriculum. So this is a good branch. If you are want to be academic, it's also a good thing. Your growth and personal growth may be limited, but you can doing your assistant professor, associate professor, HOD, and maybe a dean. So this is the, if your choice, you can do academic. And yes, female factor is also affected as like me, because most of the time the industry is not available in every state or city, and if most of the time the rural people are from that, they are don't having the industry options. So you can do academic because most of the time medical colleges are available in most of the city. Versus industry, if you are like to do industry, then they also provide a hybrid mode in pharmacovigilance also. And also if you are relocate particular for the medical advisor CRO, then it's also a good thing. If you are doing industry also having their pros and cons, because the life is particularly, you having a growth, you having your job satisfaction. But yes, yeah, the time management, family time, then female factor, it's also affected as an industry person also. So choose whatever you do, and it's okay if you are a switch the industry to academic as well as academic to industry person, according to your convenience, according to the family planning, family management as well as time management. So it's okay, we have the option, we have the great opportunity and various branches to select, not only the one thing as like the clinician. So it's up to you. Another upcoming branch is that is the pharmacology and toxicology. I also discussed with the forensic department that they are doing a postmortem thing. So if what they can do in the drug poisoning case, toxicity cases. But yes, right now there is no any separate branches of pharmacology and toxicology. As a DM pharmac, you can work in the particular area of toxicology, but yes, toxicology screening also done in animal and clinical studies. But yes, another like separate branch is not still available. Maybe hope in the future that is the, this is also, if you are going to be particular in toxicology interest of area, then you can go. And this is also upcoming branches in future. In abroad, maybe the toxicology branches is there. So the only way to discover the limits of the possible is to go beyond them into the impossible. And this is said by Arthur C. Clarke. So I already mentioned and said that just discover yourself, just try to making the decision and do the thing which are impossible to do. Because as a clinical pharmacologist, you can do lots of the things. It's such a good branch. It's not like that you are just taking by chance and you can do nothing and you are just doing only a personal life. But yes, if you are think beyond your limits, you are doing an impossible thing, you can explore a new thing. So you can do lots of the thing as a pharmacologist too. Just not only to be academician or industry person, you can do lots of the thing. So this is my key home message that pharmacology is good branch if you are making it very interesting and you want to learn regarding it. Because many of time I see that uh, most of the thing not implemented, which are read in the guidelines, in the uh, practically SOPs which are made, but most of the time it's not implemented in every hospitals and colleges. So you can observe, you can surveillance on it, and you can implement to better in the medical healthcare for patients, for your clinical fellow, as well as yourself to be a learn regarding the pharmacology and more. enriching the knowledge and sharing the knowledge. So this is my purpose, to aware the people regarding the pharmacology, its branches, or as well as the things which are not implemented ethically, scientifically in the various colleges and hospitals.